Hi, my name is Cameron Elser, and in this video, I will be discussing breast cancer and how three different countries deal with the problems it poses in terms of healthcare, culture, government, and their strengths and weaknesses. The problem I decided to study was breast cancer. According to the National Institute of Health, in 2020, an estimated 2.3 million women were diagnosed with breast cancer, and about 685,000 women died from it. The first country that I decided to study was the United States. The second developed country I decided to study was Ireland because my family's from Ireland and breast cancer runs on my mother's side of the family. The developing country I decided to study was Brazil so I could learn more about their healthcare system. The United States has a mix of public and private healthcare insurers, with our two biggest forms of government insurance being Medicare and Medicaid. We offer out-of-pocket payment plans and employee-based private insurance as well. We have a dispersed organizational model of healthcare. Strengths of the U.S. healthcare system include having a large and well-trained workforce, a wide range of medical specialists, and advanced technology. Weaknesses include incomplete coverage of all citizens and unequal distribution of resources and outcomes across the country. Ireland has a dual healthcare system with both private and public options. Individuals are required to pay fees for healthcare services. They offer medical cards, which cover a wide range of health services for the financially disadvantaged. Strengths of the Irish healthcare system include addressing the significant backlog in waiting lists and strengthening the number of supports and services for people with disabilities. Weaknesses include hospital overcrowding and access to services being limited by costs and waiting times. Brazil has a universal health system. They are mainly financed by the Sistema Único de Saúde, or the SUS, which is Brazil's universal healthcare system. Under the SUS, everyone is entitled to comprehensive health services regardless of their ability to pay. Strengths of Brazil's healthcare system include the creation of a universal healthcare system that provides free healthcare to all citizens and a reduction in infant mortality rates. Weaknesses include low quality of care and unequal access to healthcare services. Breast cancer is the most common cancer in women in the United States. Oncoplastic surgeries have been introduced, which eliminates the tumor and reconstructs the breast in one procedure. Congress has recently passed an act which allows states to use Medicaid to cover treatment for women diagnosed with cancer. Non-Hispanic Black women have had a 41% higher death rate from breast cancer than non-Hispanic white women in the U.S. Healthcare system distrust has been increasingly shown to be important when it comes to the outcomes of breast cancer diagnoses, specifically amongst racial minorities. In Ireland, around 3,700 new cases of breast cancer are diagnosed each year. Surgical excision biopsy under general anesthetic has decreased, and the use of cosmetic surgeries post-mastectomy and chemotherapy have increased. Ireland has launched a nationwide program to improve cancer rates on a systemic level. However, a low health literacy in Ireland has led to many citizens being misinformed about cancer risk. The Irish government has a handbook that details how the healthcare system plans to deal with breast cancer in the coming years. In 2020 in Brazil, about 66,000 women had breast cancer. In the past few decades, breast cancer has been shown as the leading cause of death from cancer among Brazilian women. While mortality rates have been decreasing, incidence rates have been increasing, and mammogram screenings are well below the world average. There's been a lack of hereditary cancer testing and counseling, as well as a lack of health literacy in women most likely to be affected by breast cancer. The INCA has launched national recommendations on healthy nutrition and exercise and their relation to cancer. In all countries, breast cancer is the leading type of cancer in women. Mammograms are often the most popular way to diagnose breast cancer. In the US, Black women are more likely to be diagnosed with breast cancer, and in Brazil, a lack of technology advancements has made it difficult to treat breast cancer. The US has a high number of cancer specialists who are more adept at providing care than the primary care doctors in Brazil. Ireland's healthcare system has launched a program to improve cancer care through education of citizens, whereas Brazil has not. The US is known as an obese country. I learned that weight gain can lead to the increased chances of getting breast cancer. In Ireland, women have children later in life, which also leads to increased rates of breast cancer. In Brazil, transgender patients are underrepresented, and transgender women have an increased chance of getting breast cancer. Ireland's government puts much less money into cancer treatment compared to the US and Brazil. The US government is putting more money into research and less into treatment methods, and Brazil's government doesn't put much money into either as well. Overall, I think all countries have done a lot for how they handle breast cancer in their country. I do wish a bit more money was being put into research and treatment, but I'm glad something is being done at all. While all countries have done great, I think there's still more to go in terms of